change how services are provided for efficiency. Now, any change, that's what people are afraid of, any change really could have sometimes bad consequences or scary consequences when they try to implement a new system in any institution, whether it's a business, an insurance company, private, or Medicare. There are always bumps in the road. Sometimes people don't get what they need right away. So there are some scary things and some good things. But generally, Congress is trying to strengthen Medicare and Medicaid so that it'll be around for the long haul. And one thing that I learned this year that I want everybody to understand in terms of the Medicare part, many people in our country cherish Medicare and really value it as an important guarantee to us and as we're seniors and elders. Right now, there are 45 million people on Medicare. So in our country, the federal government is working to administer a program that insures 45 million people in every state, right? Within 25 years, which is about the time that I'm going to have Medicare, just because our population is aging, there are going to be 79 million people on Medicare. If you want to research that and other statistics, a really good source is the Kaiser Family Foundation. It's a nonprofit academic institution that's been around for 30 years, studying health policy that works bipartisan on kind of the facts of healthcare and all of the options and writes papers on everybody's proposals. And that's www.kff.org for Kaiser Family Foundation. But we are looking at, within the next 25 years, having the number of folks on Medicare go from 45 million to 79 million. And while I think that it's important to have really rich discussion, one thing that I will say that I'm very, very convinced of is that it's not okay. Our Medicare system will not survive unless we do make some significant changes to make it efficient, to make sure that every dime that we spend is related to health outcomes, to ensure that there's real access for people no matter where they live. So leaving our Medicare system the way it is will be a problem. We have to make some changes or it will not survive, for example, for me to enroll in 25 years, along with the other millions of new folks. Some of the changes that are that could affect caregivers and folks on Medicare, and the disability community is my main source for this, and I have references. If anyone wants to look this up, I'm happy to tell you where to go on the internet. But they are really taking all of the best practices that have happened around the country, that academic institutions like the Mayo Clinic and even our own Washington University Medical School and that small hospitals and medical centers and places have figured out how to help people with disabilities and seniors live independently. And they're trying to make incentives for the community to be able to really incentivize independent living if that's the choice of the individual and their family. So trying to have more care coordination money so that states and municipalities can create care coordination. An emphasis on providers working together, again in care coordination, getting paid in care coordination to keep people living independently, keep people out of the hospital, and keep people out of the nursing home if that's not the appropriate choice for them at this time. So a whole lot of independent living money is being spent, and a whole lot of incentives for communities. There's also the Community Choice Act and the Class Act. Things that used to be independent legislation are in both of the bills. The Class Act is something that is also controversial, but it is a long-term care insurance program that is run by the federal government like Medicare is. That would be a payroll deduction. That you would actually be enrolled in it unless you chose to be opted out, the same way that you do with Medicare Part B, right? So that, for example, if it were enacted, from the time it went into effect on, people would be paying into a long-term care insurance program, a safety net insurance program for long-term care, unless they chose not to, and there's no penalty for choosing not to. That's pretty remarkable compared to now trying to educate everyone about planning for long-term care services and long-term care, how to pay for it. The other thing is the Community First Choice Act. We have some of this in Missouri and the disability community here. I have a little table out there with a brochure called DCHR, the Disability, well, it's a healthcare reform coalition for people with disabilities in Missouri. They are the leads in this thinking, but they've already been trying to transform the state so that if the state is spending Medicaid money and other monies, that if a person can live independently, and we also save money by providing support services and personal care attendants and nursing services to people in their home instead of having them go to an institution, that the state should spend its money that way. And the federal bills also move that a long way down the road. And so anyone who's interested in that should pick up that brochure, the Disability Coalition for Healthcare Reform. The other thing that's a significant change in terms of public programs like Medicare is that they are going to change the payment for Medicare Advantage plans. Now this is something that a lot of seniors are really opposed to, and in fact it will impact a lot of seniors if you really like your Medicare Advantage plan. So most Americans, about 75% who have Medicare, are in traditional Medicare. That's the red, white, and blue card. The benefits are the same no matter where you live in the country. The rules are the same, the benefits are the same. You go to Medicare providers. When at approximately the same time, no, it was a little bit before they did Part D, they created Medicare Advantage plans, which used to be called Medicare Choice plans. Those are private Medicare HMO type plans that you can opt out of regular Medicare and go into that has pluses and minuses. So it's like going into a private insurance plan, and then you're in a private insurance network with doctors, not all Medicare doctors, but just the doctors for that plan. You can only go to hospitals and facilities that are part of that plan. And one of the things that's an advantage for some people is they might choose to give different benefits. Like they might offer a dental benefit, which regular Medicare doesn't have. So that's what these Medicare Advantage plans are. When I was at Legal Services, I helped many, many seniors with those plans. Some worked really well. Some I had to help them get out of them because some of those plans don't provide as much coverage if you get really, really sick. So if you're relatively healthy, you have really good secondary insurance, and you have some money, those plans might be a really good choice because you might get dental and vision, and you might have even more services available through the providers. But oftentimes if you get really, really sick and you need benefits outside of those provider networks, you end up paying for those. And I've had folks who had huge bills. But they really do work for some people, mostly for folks who are healthy and have lots of financial options. There are also some Medicare Advantage plans that are special needs. They're specifically for people with diabetes and people with heart failure. Those programs actually also work really well. And when the federal government created and then enhanced those plans under the Medicare Modernization and Improvement Act, they actually paid those private insurance plans, this is for-profit private insurance, there's a couple nonprofits, more than what you pay for a beneficiary to have regular Medicare. So they actually incentivize the insurance industry to create these plans by paying them more than what the federal government actually pays per person in regular Medicare. So the change to Medicare Advantage plans, which is a whole lot of what the brouhaha has been about, is that over the next 5 years, the federal government is no longer going to pay those Medicare Advantage insurance companies a higher rate of reimbursement than what people would get as a regular Medicare beneficiary, and they're going to gradually ramp it down. Now, what will the consequences of that be? For the government, and the motivation behind it is a significant amount of money, less money being spent on those Medicare beneficiaries, which they're using to make other improvements. But it is true that those Medicare insurance companies, when they get less money per person, are going to make some changes. They might decide to change their benefit structure, they could decide to change their copays, and they could decide to provide fewer services. So there will be a change. Those insurance companies are going to react. Some of them may even get out of the market. What that does, though, no one is going to lose their Medicare. If your Medicare Advantage program no longer works for you during the next enrollment period, you could choose a different one, or you could go to regular Medicare. People are not going to be uninsured, but it will impact seniors who are in those programs. So that's a lot of information and a general overview of what's in all the Congress's bills, and I tried to give a little special information about how it will impact seniors and people with disabilities, which should be of interest to you as caregivers. I want to let you know now how you could influence whatever it is you would like to see. At this moment in time, Congress is trying to decide, as I said, how to move forward